Hello guys, welcome back to Army in White. Today we'll be continuing our previous lecture, that is the respiratory pathology, pneumothorax. Okay, previously we've talked about type of pneumothorax and definitions. Okay, let's do. Last time I talked about pneumothorax and its type. Okay, pneumothorax means the presence of air in the pleural cavity is called pneumothorax, and its type can be spontaneous and traumatic. Spontaneous are of two types, primary and secondary. In secondary, lung disease is involved. Here no lung disease is involved. In the traumatic pneumothorax we'll be talking today, let's see. In the traumatic pneumothorax, from the word itself it is very clear that there will be some type of trauma involved. They are of two types. They are divided into two types, that is non-iatrogenic and iatrogenic. Non-iatrogenic and iatrogenic, if you know the term iatrogenic, well and good. If you don't know, I'll explain. Iatrogenic means due to some unwanted mistakes, or these are the unwanted problem created by the medical professionals, okay, like the doctor, nurse, or the pharmacist. It is accident and they don't want this to be happen, but it happens due to some mistakes by the doctors or the nurse or the medical professions, anybody who are involved. These are called iatrogenic. Okay, and non-iatrogenic, from the word itself, non-iatrogenic means there is no any medical profession involved. So here let's see, in the non-iatrogenic, blunt trauma can lead to traumatic pneumothorax, stab wound, and the bullet injury. Okay, blunt trauma during accident, ribs can be broken down and pierce the lung, and that can lead to traumatic pneumothorax and stab wound and bullet injury. Okay, and in the iatrogenic, unwanted problem created by the medical practitioners during surgery or pharmacologically, it can happen. And the most important one is the PCR, or cardiopulmonary resuscitation, and the positive pressure mechanical ventilation. And next one is the pleural biopsy, transbronchial biopsy. Okay, these are the iatrogenic one. So this should be remember, this CPR and the positive pressure mechanical ventilation are iatrogenic cause of traumatic pneumothorax. This is the most important one. When we talk about the type of pneumothorax, mechanism wise, it can be of three type. That is closed pneumothorax, open pneumothorax, and the tension pneumothorax. Closed pneumothorax, from the word itself, is clear. The entry point will be closed after some time, so it is known as closed pneumothorax. Okay, that can be like we have talked already, right? In the primary spontaneous pneumothorax, that is those blabs, those bulla, it can rupture and a small amount of air can be released into the cavity. That is rupture of the blab, and the air will be entered in the pleural cavity, and the point of entry will be closed, known as closed pneumothorax. See, it's clear. Example will be primary spontaneous pneumothorax. The amount of air entry is very less and it can be disappeared. So to increase the amount of air to be disappeared as soon as possible, oxygen is given. So in the treatment, it can speed up the absorption. Okay, in the next step we will be talking about open pneumothorax. In the open pneumothorax, they are see here in the picture, see the amount of air entering and the amount of air exiting will be same. So atmospheric pressure will be equal to the pleural pressure. This is very much important to understand, and this is known as two-way pneumothorax. Okay, before one is the one way and this is the two way, because the amount of air entering and the amount of air exiting will be equal, but this can lead to serious type of pneumothorax. This can lead to serious type of pneumothorax. Chances is very high. When we talk about tension pneumothorax, is the most dangerous. See, in the pleural cavity, the pressure or the air in the pleural cavity will be very high, under high pressure. So we'll be talking this separately here. See, tension pneumothorax is the most dangerous. There is no doubt in saying tension pneumothorax is the most dangerous. Air in the pleural cavity is under high pressure. See, under high pressure, and as soon as the tension pneumothorax is suspected, the first step to be done is decompression of the chest wall must be done with a wide bore needle. Through second intercostal space. I will be showing you in picture. See, wide bore needle should be understood. Second intercostal space, from where? Second intercostal space with wide bore needle, and this is the first step, and this is the life-saving step for the patient who is under pneumothorax, that is tension pneumothorax. Okay, and I will show you how it is done. See in the picture here. See here, this is the first intercostal space, and this is the second intercostal space. This is the wide bore needle. As soon as you suspect this patient has tension pneumothorax, this is the first step, and this is the life-saving step. See how it is done. I will be showing you here. See, this is done like this. If this is the first intercostal space, then this will be the second intercostal space. So from here the white bore needle will be used to decompress the chest. From here the amount of extra air will be removed and the patient will be saved. Okay, and hope this make tension pneumothorax clear, and the decompression of the chest must be done that way. Okay, so during this pneumothorax, the stab wound or any type of wound that leads to entry of air will become one way valve. Okay, so in every inspiration the amount of the air will be entering inside the cavity, and the amount of air cannot be expelled out, so it can lead to tremendous amount of pressure inside. So this can lead to very dangerous condition to the patients. Okay, entry of the cavity cannot be released. This way lot of air will be trapped. The air will be trapped, so this way there will be very difficulty in patients for breathing. See here, the amount of the air is entering through here. It can lead to already lung collapse due to overpressure here, and see the amount of air, amount of air is here. The amount cannot be exit because it become one way valve, so it can lead to compression of the organ nearby, like the heart cable system, heart vessels, and the trachea will be deviated to the opposite direction. See here, the trachea is deviated. So this is the most important clinical findings. Okay, due to increased pressure here, see, due to increased pressure heart vessels will be pressed and the trachea deviation can be seen. Okay, all of the cable system will be compressed, leading to cardiovascular failure. In this type of pneumothorax, entry point will become one way valve. This is one way valve, and the two-way pneumothorax was a closed type. Okay, and due to this type of pneumothorax, this can be severe hypoxemia can be occur, compression of the mediastinal structure, venous return will be decreased, cardiac output will be decreased, cardiovascular system will be collapsed. These are all very important, and you must remember. Trachea will be shifted to the opposite direction. See, the most important one, trachea will be seen over shifted to the opposite direction. If the left lung is involved, trachea will go to the right side, and if it is right lung involved, then trachea will be going to the left side. Trachea deviation will be seen. And decompression of the lung with a wide bore needle through the second intercostal space with wide bore needle, and decompression is the most important and the life-saving steps here. Any type of pneumothorax can be changed into tension pneumothorax, and the most important thing or the most important causes can be CPR, positive pressure mechanical ventilation, and the trauma are the three main causes of tension pneumothorax. Okay, clinical finding. What are the clinical findings? What type of patient will be appear in front of us with the tension pneumothorax? It can be patient with difficulty in breathing. You all know one lung is already collapsed, lots of air is trapped in the cavity. CVE, yes, cardiovascular system collapse, distress, and anxious patient will be seen. Sympathetic overflow, heavy sympathetic overflow will be seen in the patient. Sweating will be the respiratory distress. No need, there's no fun in explaining respiratory distress, and the patient will be very pale, BP will be low, pulse rate will be decreasing when we do any percussion. There will be hyper resonance can be seen, and the absence of breathing sound will be observed in this type of patient. So I think this makes you clear. Decompression of the lung is the most important step in tension pneumothorax patient, and that is the life-saving step with a wide bore needle through the second intercostal space. This can be asked in exam because it is the most important steps in tension pneumothorax. Hope you understand. If there is anything you didn't understand, please write down in the comment section below. I'll be always there to answer your question. In the next video, we'll be talking about some clinical case histories regarding pneumothorax and some multiple choice questions, and with that we will be closing our respiratory pathology, not respiratory pathology, with the pneumothorax topic. In the next video we'll be talking about another pathology of respiratory system. Okay, thank you guys, and hope I make this small topic easy for you. Please like, share, and subscribe.